Quite a few variables are based on perceptions. Some of the variables are inputs of happiness rather than achieved happiness. Of all domains, botanists have most the sufficiency in health, then ecology, psychological well-being, and community vitality. Urban areas do better in health, living standards, and education. Rural areas do better in community vitality, cultural resilience, and good governance. Unmarried people, this is again one may not like it, unmarried people and young people are among the happiest. and, and men are more happier than women. This also, that is what the botanist study has shown. The results showed substantial. Following the trend set by Bhutan set the trend. Following the trend set by Bhutan, the United Kingdom and OECD countries have initiated studies on measurement of happiness with a major difference in the coverage of domains. These studies are confined to psychological well-being, whereas the Bhutan study is much more wider coverage, whereas the UK study and OECD studies confined to psychological well-being. The official national statistics of UK has recently conducted a survey and released data on satisfaction, happiness, anxiety, and feeling that life is worthwhile. These results showed substantial variation across social groups. For instance, the data shows that being unemployed, this is in UK, made substantial difference to overall well-being. The unemployed people reported less daily happiness, more daily anxiety, and less strong feelings that life is worthwhile. Though despite the social security, UK is covered by social security, unemployment is a major issue there. World Happiness Report brought out by the UN Sustainable Development Solutions Network, a global initiative for the United Nations, adopted with the OECD guidelines for the measurement of psychological well-being, which ensures international comparability across countries. In this framework, well-being has three distinct components. I skipped that. In the World Happiness Report, 156 countries were ranked on happiness during 2010-11, as well as measured changes in happiness between 2005-7 and 2010-11. The happiness estimate is based on the data collected by the Gallup World Poll since 2005. Each country they cover about 1,000 individuals, adults, 15 years and above. And this has every year they repeat the survey, and they take 3 years average to represent the well-being of a country. And these are available in the World Happiness Report. Every year they bring out the report. United Nations brings out the report, World Happiness. Dayton extensively used the data on happiness indices for identifying the factors contributing to the happiness. There is another measure. Next measure was Social Progress Index. Measures the extent to which countries provide for social and environmental needs of their citizens. The index was published by the non-profit Social Progress Initiative, Imperative. It was based on the writings of Amartya Sen, North Douglas, and Joseph Stiglitz. Social Progress Index measures the well-being of a society by observing social and environmental outcomes directly rather than economic factors. Social Progress Index is not based on perceptions. It is actual observed data, observed outcomes. So the index consists of 3 dimensions of a society: basic human needs, foundations of well-being, and opportunity. Each of these dimensions is disaggregated into 4 components, and each component covers 3 to 6 indicators. There is another index. World Happiness Index is one. Social Progress Index is another. The third one also has become popular now. That is Happy Planet Index. Introduced by the New Economic Foundation in July 2006. Is an index of human well-being and environmental impact. It gives lot of emphasis on environmental damage. The index is a combination of ecological footprint and life satisfaction. The ecological footprint is the amount of land needed to provide for all the resources requirements, plus the amount of vegetated land needed to absorb the CO2 emissions embodied in the products they consume. Life satisfaction covers health as well as subjective well-being. 150 countries were ranked based on their life expectancy, experienced well-being, and ecological footprint. 9 out of the top 10 countries were located in the Caribbean basin, despite high levels of poverty. The ranking is led by Costa Rica. Among the top 5 biggest countries in terms of GDP, Japan has the highest ranking in 45th place, followed by Germany 46th. France is 50th, China 60th, and US is ranked 105. US is at the bottom if you are incorporating what you call ecological footprint into the consideration of well-being. Here, India ranked 35. India is better than China and Sri Lanka. That we must be happy that India, at least on one aspect, scores over China. That is on world, that is Happy Planet Index. Happy Planet Index is, planet is happy, not individual is happy. Here, planet is happy, it's slightly different. Table 1, I don't know whether you can be able to see the table 1. Let me read. It presents ranking of the selected countries based on happiness index as well as social progress index. By and large, both indices produce similar ranking for the selected countries. It is worth observing from both the well-being ranking and social well-being rankings that those social democratic countries which follow social welfare programs such as Denmark, Norway, Switzerland, and Netherlands and Sweden perform better than neoliberal countries such as US, Japan, Australia. This is valid for all years. They have done for all years. These social democratic countries which has strong welfare programs do better in terms of well-being than US, Japan, Australia, though their GDP per capita may be lower than the neoliberal countries. These social democratic countries have better ranking on happiness than on GDP per capita. I don't know whether you can see it. Among the developed countries, let me say something on India's ranking on happiness and social development. Among the developing countries on happiness index and social progress indices, India fared badly compared to Indonesia, Malaysia, China, and Bangladesh. You may note that India performed badly compared to Bangladesh. Sri Lanka, though, ranked higher than Bangladesh, Pakistan, India on per capita GDP and social progress index. Social progress index is fulfillment of basic needs. It ranked lower on happiness index. This could be due to internal conflicts within that country. During the period of economic crisis, that is between 2005-7, 2010-12, happiness index showed a decline for India, Sri Lanka, and Pakistan and Malaysia, and an increase for China, Bangladesh, and Thailand. These countries were not much affected by, in terms of happiness, by economic crisis. Clearly, ranking of India on well-being indices was low. Education and health consider two major factors influencing subjective well-being and also human Basic Human Needs and Social Progress Index. Education and health are constituents as well as instruments of well-being. Most of the health and education indicators are worse than in China and Sri Lanka. That means India's most of the health and education indicators in India were worse than in China and Sri Lanka. Infant mortality rate in India at 50, this is that year, 2010 UNDP estimate, was 3 times more than that in China and 4 times more than that in Sri Lanka. Maternity mortality rate at 450 was about 10 times more than that in China and Sri Lanka. Life expectancy at birth at 64 years was about 10 years less than that in China and Sri Lanka. Mean year of schooling of adults at 4.4 years was nearly half of that in China and Sri Lanka. What is worse, India fared badly on health and education indicators, even compared to some of the less developed countries. For instance, Bangladesh, with less than half the per capita income, improved its position on some of the development indicators and reported better outcomes than that of India. Of course, maternity mortality rate is slightly lower in Bangladesh than India. It has a higher life expectancy at birth, higher mean years of schooling, and lower gender inequality. There are some studies on happiness in India. There are 2 studies I happen to read carefully 2 studies. A primary survey of 315 respondents was conducted in 2007 in 2 divisions of Chennai Corporation. That is related to your urban thing. Its questionnaire included a question on happiness. The analysis of data revealed that both absolute and relative income would positively influence happiness. That is, of course, obvious that my income may be higher, but if my neighbor gets more, I will be unhappy. So both the absolute income and relative income in urban area of Chennai, they found that it influences happiness. There are other factors. All this I found it more interesting. Assam Human Development Report 2013. You see where is Professor Alkanaran Sharma? He was the instrumental for this report. IHD was instrumental. He's not there. His institute has done, and he asked me to review that report. Made an effort to measure subjective well-being based on a large state-wide household survey. The directorate has done the survey. The ICSR institutes in Gujarat, in Gauti also has joined with IHT in conducting the survey. It has considered 8 domains. This I leave aside. The report analyzed inter-district variations in levels of well-being. It identified possible reasons for people's dissatisfaction. It clearly established that people's dissatisfied with in the governance domain. Hence, the report was not released. The composite method shows that among the districts, Morigaon, Sonapur, and Sachar are at the bottom on well-being indices. It is a very interesting report. I don't want to take much time. Let me come to the well-being within India. What is happening in the post-reform period? Real per capita consumer expenditure grew at an annual rate of 1% per annum. Next slide, we put the next slide. Not this one, yeah. The real per capita consumer expenditure grew at an annual rate of 1% in rural areas and 1.7% in urban areas in the pre-reform period, which I considered. It accelerated to 1.62% in rural areas and 2.77% in urban areas in the post-reform period. The growth rates reveal that tendency towards pro-poor growth in rural consumption expenditure during the pre-reform period was reversed in the post-reform period. That means in the pre-reform period, intra-inequalities in the rural sector was declining, but that was reversed in the post-reform period. Disparities between rich and poor in urban areas were further worsened during the post-reform period. Even the pre-reform period also, intra-urban inequalities showed a positive trend, which was worsened during the post-reform period. It is evident that growth in the post-reform period was pro-rich. The urban middle and top expenditure groups gained the most. Definitely the outcome of growth was not inclusive. I have analyzed this also using the Atkinson social welfare function. The results are similar, so I don't want to spend on it, my time on it. But I would say that on the whole, it is the rising inequality in both periods, particularly the post-reform period, reduced the potential growth in economic welfare. In another paper, we have analyzed how interstate inequalities as well as intrastate inequalities, rural-urban inequalities affect the total well-being of the nation. And we found that had there been at least 93, 90 level inequalities were at that level, there would have been substantial gain in social well-being as well as reduction of income poverty. This table, which I showed, ranks states in inverse of deprivation index, inverse of income poverty, and per capita gross domestic product. The deprivation, I have taken the housing, education, very many indicators I have taken and constructed the index of deprivation. So inverse of deprivation is better. That means the less deprivation, the better. Inverse of income poverty, the other one, and per capita state domestic product, another. So it shows the ranking of the states on this. It is evident that all the three indicators showed more or less similar pattern ranking among the states. However, there are some outliers. It is observed that Gujarat, Haryana, and Maharashtra, though ranked high on per capita GSDP, had middle position in the ranking on the inverse of incidence of poverty and inverse of deprivations. See, Gujarat we consider as a model, but just see, it's okay. It is better on per capita GSDP, but not so in terms of deprivation. Deprivation levels are not commensurate with GSDP. Jammu and Kashmir, with very low ranking on per capita GSDP, had low incidence of poverty and placed middle in the ranking on inverse of overall deprivation. Goa, Kerala, Delhi, Sikkim, and Himachal Pradesh, in that order, fared better in terms of low income incidence of deprivations as well as poverty, followed by Punjab, Jammu, Kashmir, Tamil Nadu, and Haryana. On the other hand, which is very clear, in any way you measure, Bihar, Jharkhand, Chhattisgarh, Odisha, Madhya Pradesh, Uttar Pradesh, Rajasthan, and Assam fared badly. It is observed that northeastern states, other than Assam, though ranked low on per capita GSDP, were better placed in terms of low incidence of poverty and deprivations. And I may say that in Northeast, malnutrition levels are extremely low. Malnutrition, and some of the states are comparable with Kerala in terms of education as well as malnutrition. But that per capita GSDP is low. It is also the two things. This is again my impressions. One is it's more egalitarian. I did as a member of a committee, I visited Northeast some years ago. One is it is a more egalitarian society, and the women groups are very strong in Northeast. And in general, many states in Northeast are better on well-being and has low malnutrition. And as I repeat again, it's comparable to Kerala. and next to Goa. Goa also is better. Table 5 provides the ranking of the states on progress made in reducing income, poverty, malnutrition, and educational deprivations, as well as aggregate ranking of states in reducing multiple deprivations in the post-reform period. That means how you rank the states in terms of their performance in reducing deprivation as well as poverty, which is a better indicator than growth of GSDP. On the overall ranking, the performance of Himachal Pradesh was the best, followed by Kerala, Tamil Nadu, and Uttarakhand and Maharashtra. And the performance of Bihar was the worst, followed by Madhya Pradesh, Jharkhand, and Arunachal Pradesh. Next slide. I think this will be more interesting for you. This table cross classifies the states by their ranking or current level of deprivation index and their ranking on reduction of deprivations. As can be seen, out of 27 states, 16 states had fallen on diagonal cells, revealing that states which made better progress in reduction of deprivation had lower current levels of deprivation. It may be noted that the basic sources of data underlying these indicators show that even in the base year, better performing states had comparatively low incidence of multiple deprivations. It implies that the rate of decline in multiple deprivations depends on initial levels of deprivations, and hence deprivation is self-perpetuating. It is clear from this table that Himachal Pradesh, Kerala, Tamil Nadu, Manipur, Sikkim, and Jammu Kashmir emerged as the best performing states in the post-reform period in reducing multiple deprivations with a low current levels of multiple deprivations. On the other hand, Bihar, Madhya Pradesh, Jharkhand, Uttar Pradesh, Rajasthan emerged as the worst performing states in the reduction of multiple deprivations, as well as high current levels of multiple deprivations. Since level of deprivation is likely to be self-perpetuating, and some of these deprivations are related to public goods, public intervention in these states with high level of